Hi everyone, welcome back to the channel. So today we'll be discussing age estimation, which is a key concept in forensic medicine, especially when it comes to practicals. Starting with dental age estimation, we'll observe the appearance of teeth. So the first teeth to appear are the lower central incisors that appear at 6 to 8 months of infancy. Then at 7 to 9 months, we have the upper central and upper lateral incisors. At 10 to 12 months, the lower lateral incisors. At 12 to 14 months, the first molars, both upper and lower. 7 to 18 months, canines. 20 to 30 months, second molars. And that completes the temporary teeth. Now coming to the eruption of permanent teeth. At 6 to 7 years, permanent first molars are the first to erupt. After that, at 6 to 8 years, permanent central incisors. At 7 to 9 years, lateral incisors. And first premolars at 9 to 11 years. Then we have the second premolars at 10 to 12 years. And also the permanent canines, 11 to 12 years. Permanent second molars at 12 to 14 years. And finally, the third molar at 17 to 25 years of age. The next important component of age estimation is the wrist joint ossification. So for that, there's a mnemonic that I made to remember the ossification order of the carpals. Chitless, which is how ideally a person should crack exams. Starting with the capitate at 2 months, then the hamate at 3 months, triquetral at 3 years, lunate at 4 years, scaphoid at 5 years, trapezium at 5 to 6 years, trapezoid at 5 to 7 years, and finally the pisiform at 9 to 12 years of age. To include the other three carpals in the mnemonic, you can call it chitless TTP, to the point, which is what we students expect any source of information to be. Moving to the next component, the elbow joint. So we'll first see the various ossification centers around the elbow joint. We have the medial epicondyle, lateral epicondyle, the trochlea, capitulum, and the olecranon process and the head of the radius. So the capitulum appears at 1 year and the trochlea appears at 9 to 11 years of age, and the lateral epicondyle appears at 11 years of age. These three fuse to form a conjoined epiphysis at around 14 to 16 years of age. This fuses with the humeral shaft at around 16 to 17 years of age. Now, the medial epicondyle appears at around 6 to 7 years of age and fuses with the shaft at around 14 to 16 years of age, around the same time that the conjoined epiphysis forms. The olecranon process of the ulna appears at 9 years and fuses with the shaft at around 16 to 17 years of age. And finally, the head of the radius appears at 5 years of age and fuses with the radial shaft at the same time, 16 to 17 years of age. Since we have the bones here, I felt it more appropriate to represent a few of other wrist joint ossification centers here. So the lower ends of the ulnar radius and the base of the first metacarpal. The lower end of the radius appears at 2 years of age and fuses with the shaft at around 18 to 19 years of age. The lower end of the ulna, on the other hand, appears at 5 to 6 years of age and fuses at 17 to 18 years of age. So you can see this order. The base of the first metacarpal appears at 2 to 3 years of age and it fuses at 15 to 17 years of age with the shaft of the first metacarpal. Next up, we have two important joints, the hip joint and the knee joint. So in the knee joint, we have the lower end of the femur, which appears at 9 months of intrauterine life, 36 weeks to be precise. And then we have the upper end of the tibia that appears at around 38 to 40 weeks intrauterine life. Basically, it appears at term. Now coming to the hip joint, we have the head of the femur, which appears at half to 1 year of age. Next, we have the greater trochanter, which appears at 4 years of age, and the fusion of the ischiopubic rami at 6 years of age, appearance of the lesser trochanter at 12 to 14 years of age, and the appearance and fusion of the triradiate cartilage at 13 to 15 years of age. The iliac crest appears at 14 years of age. and the ischial tuberosity appears at 16 years of age. The greater trochanter, head of the femur, and the lesser trochanter fuse with the shaft of the femur at 17 to 18 years of age. Next, the iliac crest fuses with the ilium at 18 to 20 years of age, and the ischial tuberosity fuses with the ischial body at 19 to 21 years of age. So these were the events of ossification across the hip joint in chronological order. So we have few more ossification centers in the knee joint. I discussed the lower end of the femur and upper end of tibia first because they have a high medical legal importance. We also have the patella that appears at 3 to 6 years, and the upper end of the fibula that appears at 4 years of age, and all of these combine with the respective bones at the age of 18 to 19 years of age. Moving to the closure of cranial sutures, here's a small mnemonic from my side that might help you remember the order of suture closure. Pam frequently spams, "Could you please let me take her phone?" Okay, it's just, "Could you let me take her phone?" So let's now spell out the mnemonic in this table. So we start with the posterior fontanelle, then the anterior fontanelle, then the metopic sutures, then the fusion of basi-occiput and basi-sphenoid, and then the sagittal suture, in which you have the posterior 1/3, anterior 1/3, the middle 1/3, then the coronal suture, lambdoid suture, and finally the temporoparietal or temporal suture. If you want to visualize all of these, there's a diagram called a lateral skiagram, which would be very helpful. So firstly, we have the posterior fontanelle, which fuses at 6 to 8 months. Then the anterior fontanelle fuses at 1.5 to 2 years of age, and the metopic suture fuses by 1 year of age. However, in 10% of the cases, it can still persist. The basi-occiput and basi-sphenoid fusion differs between males and females. In males, it fuses in 20 to 22 years. In females, 18 to 20 years of age. Sagittal sutures, the posterior 1/3 fuses at 30 to 40 years, anterior 1/3 at 40 to 50 years, middle 1/3 by 50 to 60 years of age. The lower half of the coronal suture fuses at 40 to 50 years of age, the upper half at 50 to 60 years of age. The lambdoid suture also has an upper half and a lower half, wherein the upper half fuses at 50 to 60 years of age and the lower half by 60 to 70 years of age. And finally, the temporal suture fuses by 60 to 70 years of age. So another two bonus sutures to remember are the pterion, which fuses by 80 years of age, and the two halves of the mandible that fuse by 1 to 2 years of age. Next, we have the sternum, which ossifies from 6 centers, with the manubrium sterni and the first sternebrae, which appear in the 5th month of intrauterine life. Then the second and third sternebrae, which appear at the 7th month of intrauterine life. The fourth sternibra at the 10th month of intrauterine life, and the xiphisternum at 3 years of age. The third and fourth sternebrae fuse at 15 years of age, second and third at 20 years, and first and second at 25 years. It occurs in a down to up fashion. The xiphisternum fuses with the body at 40 to 45 years, and the manubrium sterni fuses at 60 to 70 years of age with the body of the sternum. Along with that, you can also remember the middle end of the clavicle, which appears at 15 to 17 years and fuses at 20 to 22 years of age. Now we'll look at fetal age estimation. So there are two rules which we use to assess fetal length, but before that, we look at the two types of fetal length. We have crown rump length or CRL and crown heel length or CHL. So the relationship between the two is as follows. Add the lower limb length to the CRL to get the CHL. CRL is basically 2/3 of the CHL. So the first rule, that is Hassey's rule, if the total fetal length is less than 25 centimeter, its age in months will be given by square root of the CHL value in centimeters. So Morrison's rule states that if the total fetal length, which is basically the CHL, is more than or equal to 25 centimeter, divide the CHL by 5 to get the age in months. So this is lunar months. Next, we'll see the various ossification centers in the fetus that are of medical legal importance. At the 5th month of intrauterine life, we have the ossification center for the calcaneum, which is always the first to appear. It's only after that we get the centers for the manubrium and the first sternebrae. In the 7th month of intrauterine life, we get sternebrae 2 and 3 along with the talus. At 36 weeks of intrauterine life, basically the 9th month of gestation, the lower end of femur appears. This is of high medical legal importance because when this is visible in a baby, it indicates viability. That is the ability of the fetus to lead an independent existence when removed from the mother. At 38 weeks of gestation, the upper end of the tibia appears, and at 40 weeks, we get the cuboid, fourth sternebrae, and the xiphisternum. Now, here are few important events in intrauterine life that you should remember month-wise. In the first month, eye spots appear and cardiac activity starts. In the second month, limb buds appear. They look kind of like this, I guess. I don't know, I'm just drawing something. So in the third month of gestation, nails appear. So they'll be like very small. They gradually grow towards and beyond the fingertip as term approaches. In the 4th month, lanugo appears and sex differentiation occurs. In the 5th month of gestation, scalp hair and vernix caseosa appear, and testes are located at the psoas major. At the 6th month of gestation, eyebrows and lashes appear, the nails become distinct, and the testes descend to the level of the kidney. At the 7th month of gestation, eyelids open, and then the testes reach the deep inguinal ring, and eyelids and eyelashes become distinct. At the 8th month of gestation, testes will be in the inguinal canal. Sometimes the left testis can descend into the scrotum, and the nails grow enough to finally reach the fingertips. At the 9th month of gestation, that is at full term, both the testes will have descended into the scrotum, and then the nails will have grown beyond the fingertips. So this completes age estimation, at least whatever is important with respect to forensic medicine. And I hope this video was slightly helpful with your exam prep. I hope it made your life a bit easier. If not, you can kindly put your suggestions or feedback in the comment section below. Thank you for watching. Stay tuned for more.